Thank you, and let me welcome you to the show this morning. The topic this morning is chemically dependent pregnant women. And we're fortunate to have with us two persons to talk about women who are involved in substance abuse during the period of pregnancy. Ms. JBoyd. Ms. Boyd is the therapist, the chief therapist for this program at Meharry Medical College. And with Ms. Boyd is Ms. JoAnne-Wade. Ms. Wade is a teacher therapist for the Alcohol and Substance Abuse in Pregnancy program at Meharry Medical College. And let me welcome both of you to the program this morning.
Thank you.
Ms. Boyd, let's start off with you by first having you to give us some information about how you became involved with such a program. That is, a little information about your background in education. And of course, Ms. Wade will do the same thing, after which we will get into the topic itself, the topic this morning.
Okay. I started out in psychology. I graduated from Tennessee State University with a BS in psychology and a minor in sociology. I then attended graduate school and got a master's in general psychology and began working in the mental health center at Meharry Medical College. But actually, I worked in the alcohol and drug part of the facility. Started out working with adults. I worked with adults inpatient and outpatient. I also worked with adolescents inpatient and outpatient. And that was probably my first exposure back in 1986 to pregnant, addicted women. Fortunately, I was able to work with the beginning of this program back in 1986. I was a therapist in the Meharry MADAP program, and they needed a female therapist, so they brought the women to me, and I worked with them for a period of time. And of course, the program, you know, began to develop more from that point, but that was my first exposure.
Very good. Ms. Wade, what about your experience with this program, your background and some information that you...
Well, I taught school for 22 years and happened to be kindergarten. For 22 years, I was in Chicago, and once I moved back to Nashville, I became involved with the metro system with kindergarten, after which I went to Meharry in '87, and I taught school with adolescents where I was exposed to alcohol and substance abuse in adolescents, also adults. Once our AASAP program came about, I realized that they needed a playroom for substance abuse women with their children. So that's how I become involved with the alcohol and substance abuse program.
Very good. And let's talk about this program this morning, because I think the topic this morning is chemically dependent women who are involved with substance abuse, who are dependent on substance, whatever the substance might be, during pregnancy. Let's talk about that. Who are these women, and why is this program so important?
These are women just from all socioeconomic backgrounds. One of the things that we do know about chemically dependent women is that about 10% of pregnant women across the board are chemically dependent.
So this is no minority kind of thing?
No, it isn't. It reaches all socioeconomic backgrounds, and that's one of the myths that we need to dispel. You know, a lot of people seem to think that drugs are only found in the inner city, and that's simply not true.
Well, what kind of drugs are we talking about here? I mean, substance abuse covers a whole range, Ms. Wade, of many things. So what are we talking about here?
Well, we're speaking about the clients that we work with majority of cocaine, alcohol, and erotics. That's the statistic that we have had worked with.
Now, what do you find about cocaine abuse in pregnant women? I mean, what are some of the examples that you could give and some of the things that will sort of highlight this program and the importance of this program for our audience this morning?
Well, basically, cocaine addiction is a very difficult addiction to treat. And although with a woman, her primary choice may be cocaine, a lot of times she does use alcohol and marijuana and other things to come down off, you know, as she comes down off the cocaine high. So most of our women, although they may be primary cocaine users, they're actually polysubstance abusers. However, the population we see tend to be primary cocaine users, and of course, alcohol is the widest drug that is abused and probably the one that's the most underrated. The relapse rate of cocaine-addicted people in general is very high. which simply means that sometimes people are treated for this addiction and then they return to using the drug. So it's very difficult. And the population itself is difficult to target.
Yes.
You may have, there are some doctors who do not want to expose their clients, or perhaps may just not have the knowledge base of who actually is chemically addicted. So many of those women are missed. And oftentimes I think that they feel that if they do expose themselves, that their children may be taken away from them through DHS custody.
Well, now the program that you have now, what's the genesis of this program? Now, where did this program come from, and how did it end up at Meharry? What's the official name of the program now?
The program is called AASAP, Alcohol and Substance Abuse and Pregnancy Program, which actually started through a grant with the state of Tennessee. I think it was under mental health and retardation at that time in 1986, through Meharry Medical College. The program at that time just had a skeletal staff and was very small, and the grant was rewritten and funded by the federal government about 3 years ago. So now, you know, we do work with just a multitude of professionals.
How many people do you have involved in this program? How many clients and how many how many staff members do you have? Is this a large program or what?
Yes, right now we have 13 staff members, and I can say over the years that we have been in process, it has, I think we've served about 150 women so far.
So